Thank you, Mr. Chair and members.
Move the bill due pass to appropriations.
We have a motion and a second.
Thank you. This is a companion bill to Senator Pan's bill to increase the tobacco tax by $2. It allocates those revenues towards important programs, including increasing Medi-Cal provider reimbursement rates, something many of you on this committee are very supportive of. I respectfully ask for your aye vote. And I have with me witnesses. I have Kimberly Amazine of the American Lung Association, Elisa Sanchez of the California Medical Association, and Beth Capel of Health Access.
Alicia Sanchez with the California Medical Association. We're a co-sponsor of this legislation, and we have committed to working to increase the tobacco tax by 2016. And this bill does not do that. This bill simply allocates the money, which we think hopefully we can all agree that that's a very important decision on how that money gets allocated. It would address access to care within Medi-Cal. It would help support law enforcement to help prevent smuggling, as well as enforce existing tobacco control laws, as well as funding tobacco prevention programs. And that statement of how the money would be spent is a very important one. We urge you all to support the bill. Thank you.
Good evening, members of the committee. Kimberly Amazine with the American Lung Association in California, proud co-sponsor of the bill. Here's a fact we can all be proud of. California currently has the second lowest prevalence rate in the nation, second only to Utah. But that really only tells part of the story. The fact is we have 3.6 million people who still smoke in this state and over 200,000 youth who smoke. And just to put that into context, that is equivalent to our neighboring state of the entire population of Oregon. We have a significant burden that the state takes on with smoking-related disease and death. Tobacco continues to be the #1 preventable cause of disease and death in California. There is something we can do. It's been 17 years since the tobacco tax has been raised in California. We are 33rd in the country. There is evidence that there is a significant return on the investment when you put the money into prevention and improve treatments and create better access to care for our most vulnerable populations. We save this state money and we save lives. We respectfully ask for your aye vote.
Beth Capel on behalf of Health Access California, here in support of this measure. Unfortunately, those who are on Medi-Cal are disproportionately likely to smoke and disproportionately likely to suffer the adverse consequences. This bill appropriately invests a goodly share of the results of the tobacco tax into improving the Medi-Cal program. Thank you.
Other witnesses in support.
Christina Romero, Planned Parenthood Affiliates of California, in support.
Other witnesses in support.
Mr. Chairman and members, Terry Brennan on behalf of SEIU California in support. This bill saves lives and defrays the taxpayer cost of smoking-related diseases.
Chair and members, Autumn Ogden with American Cancer Society Cancer Action Network, also in support of this bill.
Callie Hamt on behalf of the American Heart and American Stroke Association, proud co-sponsor.
Allison Ramey with Blue Shield of California, as a member of the Save Lives Coalition, we're here in support of this measure.
Kimberly Chen with the California Pan-Ethnic Health Network, in support.
Thank you. And seeing no further witnesses in support, witnesses in opposition? Seeing none, questions or comments from the committee? Mr. Wood?
Just one briefly. First of all, thank you for your leadership on this. I'd be honored if you consider me as a potential co-author. Look forward to working with you on this important issue for citizens of California.
Thank you, Dr. Wood.
Okay. Any other questions or comments from the committee? Seeing none, Mr. Bonta, you may close.
Thank you for your consideration, colleagues. I respectfully ask for your aye vote.
We have a motion and a second due pass to appropriations. I'd ask the clerk to please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine?
No.
Mainshine, no. Bonilla? Burke? Burke, aye. Chavez? Chavez, no. Chu? Chu, aye. Gomez? Gomez, aye. Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Lackey? Lackey, aye. Nazarian? Nazarian, aye. Patterson? Patterson, no. Ridley Thomas? Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Steinnorth? Steinnorth, no. Thurmond? Thurmond, aye. Waldron? Waldron, no. Wood? Wood, aye. 12 to 5.
12 to 5, your motion passes.
Thank you, colleagues. We have the consent calendar. We can entertain a motion. We have a motion and a second on the consent calendar. Madam Secretary, please call the roll.
Bonta.
Aye.
Bonta, aye. Mainshine. Mainshine, aye. Bonilla. Burke. Burke, aye. Chavez. Chavez, aye. Chu. Chu, aye. Gomez. Gomez, aye. Gonzalez. Gonzalez, aye. Hernandez. Hernandez, aye. Lackey. Lackey, aye. Nazarian. Nazarian, aye. Patterson. Patterson, aye. Ridley Thomas. Rodriguez. Rodriguez, aye. Santiago. Santiago, aye. Steinnorth. Steinnorth, aye. Thurmond. Thurmond, aye. Waldron. Waldron, aye. Wood. Wood, aye. Bonilla, aye. 18-0.
I think we should, yeah. So we do add-ons.
Yeah, that was 18. 18-0.
18-0 on the consent calendar. The consent calendar passes. We're going to do.
Yeah. Okay, there's only one on call. Sure.
We have one bill on call. We're going to do that bill first, and then we're going to go through all of the bills for add-ons. The bill that's on call is item number 26, AB 1425, Assemblymember Allen. Please call the absent members at the time.
Chavez? Aye. Chavez, aye. Chu? Chu, no. Hernandez?
No.
Hernandez, no. Nazarian? Nazarian not voting. Rodriguez? Rodriguez, no. Santiago? Santiago, no. Yes.
So it failed.
Yes.
We do the whole thing.
7 to 11, fails passage.
The vote is 7 aye, 11 no. The bill fails passage at this time. We will. There's a request for consideration, and the request for consideration is granted for reconsideration. Sorry? Okay, we're going to call add-ons starting with item number 1, AB 68, Assemblymember Waldron.
Bonilla?
Item 1, AB 68. We're starting from the top.
Bonilla, aye. Gomez?
Yes.
Gomez, aye. Nazarian? Aye. Nazarian, aye. Steinnorth? Aye. Steinnorth, aye. 19-0.
That bill passes 19-0. Next is item number 2, AB 176, Bonta.
Bonilla? Aye. Bonilla, aye. Chu? Chu, aye. Ridley Thomas? 18-0.
Was it?
18-0.
That bill passes 18-0. Item number 3, AB 299, Assemblymember Brown.
Bonilla? Aye. Bonilla, aye. Chavez? Aye. Chavez, aye. Chu? Chu, aye. Hernandez? Aye. Hernandez, aye. Nazarian? Aye. Nazarian, aye. Patterson? Aye. Patterson, aye. Santiago? Aye. Santiago, aye. 19-0.
That bill passes 19-0. There was no vote taken on item number 5. We're going to item number 6, AB 486, Assemblymember Bonilla.
Hernandez? Aye. Hernandez, aye. Lackey?
6.
Lackey, aye. Waldron? Waldron, aye. 19-0.
That bill passes 19-0. Next is item number 7, AB 521, Nazarian.
Bonilla? Bonilla, aye. Chu? Chu, aye. Lackey?
No.
Lackey, no. 13 to 5.
That bill passes 13 to 5. Item number 8, AB 533, Bonta.
Bonilla? Bonilla, aye. Ridley Thomas? 17-0.
That bill passes 17-0. Item number 9, AB 623, Dr. Wood.
I've used an aye.
Item number 9, AB 623, Dr. Wood.
Hernandez? Hernandez, aye. Rodriguez? Rodriguez, aye. 15 to 4.
That bill passes 15 to 4. Item number 10, AB 741, Williams.
Bonilla? Bonilla, aye. Chu? Chu, aye. Gomez?
This is AB 741?
Yes.
Gomez, aye. Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Nazarian? Nazarian, aye. Santiago? Santiago, aye. 17-0. I'm sorry, 19-0.
That bill passes 19-0. Item number 11 was a consent calendar item, so we're going to item number 12, AB 766, Ridley Thomas.
Bonilla? Bonilla, aye. Gomez? Gomez, aye. Gonzalez? Gonzalez, aye. Nazarian? Nazarian, aye. Steinnorth? Steinnorth, aye. 19-0.
That bill passes 19-0. Item number 13 was turned into a 2-year bill, so we'll go to item 14, AB 1018, Cooper.
Bonilla? Bonilla, aye. Gomez? Gomez, aye. Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Nazarian? Nazarian, aye. Steinnorth? Steinnorth, aye. Waldron? 18-0.
That bill passes 18-0. Item number 15 was a consent calendar item, so we'll go to item 16, AB 1117, Garcia. Christina Garcia.
Chu? Chu, aye. Gomez? Gomez, aye. Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Lackey? Lackey, aye. Nazarian? Nazarian, aye. Santiago? Santiago, aye. 18-0.
The bill passes 18-0. Next is item 17, AB 1133, Ashajian.
Bonilla? Bonilla, aye. Gomez? Gomez, aye. Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Nazarian? Nazarian, aye. Rodriguez? Rodriguez, aye. Steinnorth? Steinnorth, aye. Waldron? 18-0.
The bill passes 18-0. Next is item 18, AB 1147, Mainshine.
Bonilla? Bonilla, aye. Chu? Chu, aye. Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Nazarian? Nazarian, aye. Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. 19-0.
The bill passes 19-0. Item number 19 was a consent calendar item, so we'll go to item 20, AB 1162, Holden.
Bonilla? Bonilla, Bonilla, aye. Gomez? Gomez, aye. Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Nazarian?
Nazarian?
Nazarian, aye. 18-1.
The bill passes 18-1. Next is item 21, AB 1177, Gomez.
Hernandez? Hernandez, aye. Lackey? Lackey, no. Waldron? Waldron, no. 14-5.
That bill passes 14-5. Item 22 was a consent calendar item, so we'll go to 23, AB 1231, Wood.
Chavez? Hernandez? Hernandez, aye. Nazarian? Nazarian, aye. Rodriguez? Rodriguez, I. Santiago. $12.31. Santiago, I. 18-0.
The bill passes 18-0. Next is item 24, AB 1300, Ridley Thomas.
Yeah. Gomez. Gomez.
Aye.
Gomez, I. Gonzalez. Gonzalez, I. Hernandez. Hernandez, I. Nazarian.
Aye.
Nazarian, I. Steinnorth. Steinnorth, I. It's 18-0.
The bill passes 18-0. Next is item number 25, AB 1396, Bonta.
Bonilla. Bonilla, I. Ridley Thomas. 13-5. 13-5.
That bill passes 13-5. Next is item 27. We already voted on item 26. So item 27 is AB 1518, Aging and Long-Term Care Committee Bill.
Bonilla. Bonilla, I. Gonzalez. Gonzalez, I. Hernandez. Hernandez, I. Nazarian. Nazarian, I. Santiago. Santiago, I. 19-0.
That bill passes 19-0. Do I need to recall the consent calendar?
Oh, I'm sorry. Chu.
Aye.
Chu, I.
Consent calendar again or no?
Sure.
Finally, the consent calendar.
Ridley Thomas. That's it.
Has everyone voted?
Yes.
We'll leave the roll open for a couple more minutes to see if there's any other members who are rushing back, and then we will adjourn.